another video. In today's video, I wanted to answer a question that I get all the time, and that is, why don't you want to be a doctor? Why do you want to be a nurse? And I get this question a lot because I actually graduated from undergrad with a biology pre-med degree. So like I had every intentions on going to med school. And when I changed my mind my senior year, everyone was like, what are you doing? Why do you want to be a nurse? Why don't you go all the way? Why don't you do this? And it's just a question that I just kind of like avoid because it's, first of all, it's rude. Like, don't ask me why I don't want to go all the way. But I just thought I would sit down and make a video with you guys because I know a lot of you are probably deciding between medical school and nursing school. And a lot of people are just curious. So if y'all are interested in my reasons for why I want to be a nurse, then just keep watching. So first of all, I think people really don't understand that being a nurse and being a doctor are two completely different things. Like one, like being a nurse is not a stepping stone for being a doctor. So it's like really invalid when you say, why don't you go all the way? Because that doesn't make any sense. Like I am going all the way in nursing. Like I don't know what that even means. So I think a lot of people think that being a nurse is like a step down from being a doctor. It's like you're kind of important, but you're not really that important, and that's really just not the case. Nursing, it took me a while to realize this too. Actually, I didn't really learn everything that nurses do, like what nursing encompasses, until I got into nursing school. But the main reason for choosing to be a nurse instead of a doctor is because of the nurse-patient relationship. So when I was in undergrad, I spent a lot of time shadowing doctors, going on mission trips like with doctors, working in the hospital and like kind of seeing what the doctors are doing, and I just never enjoyed it. I never had fun on those days. I always dreaded waking up to go shadow, and I was telling myself back then, like, maybe I just don't like it because I'm not the one doing it. You know, I'll like it when I'm the actual doctor, blah, blah, blah. Just fooling myself, honestly, just making myself believe that I really want to be a doctor because I had said that for so long. Like once upon a time, I wanted to be a pediatrician and you couldn't tell me otherwise. Like, so I spent a lot of time, actually like 3 years of my undergrad career, chasing the dream of being a doctor, but not really understanding why. So then when it became time to like really sit there and apply, I was applying for this and I could not write a personal statement on why I wanted to be a doctor. And so I was like, you know what? Maybe I can't write a personal statement because I really don't want to be one. So I sat down with myself. I really got real about it. I did my research and I really wanted to see what it was that I was missing. So I thought about when I was in the hospitals and everything, and what I enjoyed the most was actually being with the nurses. So when I was working in the nurses station on like the short stay unit, or when I was working in NICU and seeing what the nurses did, and I really enjoyed that. Even though I really wasn't doing anything, I really enjoyed it. And I realized that what was missing was the fact that the nurses spent more times with the patients. So when I was with the doctors, I just kind of noticed that when they did rounds, they just kind of popped in and out. They said, hey, like, this is what's going on with you, this is what you need to do, and then they left. And I was just like, wait, where are we going? And so the days that I was working with the nurses, I realized like they're the ones that are behind the scenes. They're the ones that are administering those drugs that the doctors orders. They're the ones who's inserting those Foleys, that's starting those IVs, that's doing all the skills that you think of when you think medicine. Doctors aren't really doing those, guys. Nurses are doing those, and I had no idea. So once I found out that like all the hands-on and personal experiences that I wanted with patients and all the skills and stuff that I thought I would be able to do once I go into medicine, like, you know, IVs and Foleys and all the cool stuff that I can think of, like dressing changes, nurses do those. Doctors don't do that. So once I realized that, I was like, well, screw this. On top of that, I like to talk. I like to talk people's heads off. So I really, really enjoy being able to like talk to my patient, really get to know them, figure out what's going on in their lives, how they got there, how they're feeling in the hospital, you know, prepare them to leave. Like I really just want to have that whole, from the time you're admitted to the time you leave, and I really wanted to have that whole spectrum of a relationship with the patient. And I felt like when I was shadowing those doctors in the hospitals, they weren't the ones getting that experience. So that really just changed my entire mind. Another reason why I chose to be a nurse instead of a doctor is I did not want to be on call. Like, I'm not even gonna lie to you guys, I do not want to be on call for nothing. When I get off from work, I want to be off from work. I don't want to be called back in for nothing at any time of the night, because y'all, I want a family, and I know that it's very possible for women to, you know, be doctors and be on call, but that's just not something that I wanted for myself. I just don't see myself wanting to get up out of bed and leave my husband or my child when I have one of those, you know, in the middle of the night. I just don't want, and I want to be off when I'm off. So the work schedule of nurses, which is very much more appealing to me. I noticed that a lot of them work 12-hour shifts 3 days a week, and then they're off for like 4, and I Love that. That sounds amazing to me. That will give me so much more of a life than I have right now. So I'm really looking forward to that. Another reason why is the versatility of being a nurse. I think I did not know this until I got into nursing school, so I'm sure a lot of people don't know this, but you can literally be anything you want if you become a nurse. Nurses can do research, they can teach, they can work on any specialty, any field. Like, nurses can specialize. We're not only just bedside nurses. You can work in cardiology, you can work in like labor and delivery, mother baby, neuro, ICU, anything, any specialty that you think of a doctor can work in, there are specific nurses for that specialty as well. Also, with nursing school, your degree makes you able to work in all those fields. You don't really have to go back into school and, like, you know, you might have to get certified again in like another area, but you don't have to, like, I feel like with medical school, once you decide your specialty and you match for residency, like, you're that kind of doctor. So like with nursing, you can switch that out. You can jump into one shift, jump into another, whenever you wanted to. So also, if I don't want to be on the bedside anymore, I can go to a clinic, I can go into teaching college, like I can do research, I can literally do whatever I want to do. I can start my own business, I can do a lot. Leading off of that, the main reason I chose to be a nurse is because you get the best of both worlds. So I'm a big nerd and I love the idea of being able to look at a patient, diagnose, and treat them just off of like the signs and the clinical manifestations. I love that. That sounds great to me. And it did kind of bum me out a little bit that nurses weren't going to be the ones diagnosing and treating. Then I found out that nurse practitioners exist, y'all. I might be late on this one, but like once I found out that you can be a nurse practitioner, I was sold. So for people who don't know what a nurse practitioner is, that is a nurse that went back to school and either got a master's or a doctorate in nursing. So with that, they have the ability to diagnose and treat patients, and in some states even open their own clinics, which is exactly what I wanted to do as a pediatrician. So once I found that out, I was done. Like, I mean, I can have the relationship with my patients that I want to for a few years. I can work as a bedside nurse and get that experience that I want. And then when I'm ready to, I can go back to school, become a nurse practitioner and have my own clinic, and then work that little 9-to-5 job that I wanted as like a pediatrician. Like, that was amazing. And on top of that, nurse practitioners can also specialize. So you can be a psychiatric nurse practitioner, a family nurse practitioner, a pediatric nurse practitioner. You can also be a CRNA, which is a certified nurse anesthetist. I can't say that word, so clearly I'm not gonna be one of those. But that's basically like the nurse practitioner version of an anesthesiologist. You can also be a nurse midwife, which means you will be delivering babies, or you can be a women's health nurse practitioner, which is what I'm looking into, and that is basically being a women's health primary care provider. So with all of those, depending on the state that you're in, you can open your own clinic, you can work in someone else's clinic, you can be like, you know, the person that they go to for like school clinics and like, you know, urgent cares. You can even work in hospitals. It's really enough for me. Once I found out that I can have the nurse-patient relationship and the ability to diagnose and treat without as much school, without as much debt, and without being on call, that was it. So yeah, so those are the reasons why I chose to be a nurse instead of a doctor. I hope that helps you guys a lot if you're making that decision on which one you want to choose, or if you were just curious to figure out why people didn't go all the way. So that's all I have for you guys today. Thank you so much for watching, and I will see you guys in the next video. Bye.